Good morning. We're on Unit 13. We have one more left next week. This week we're going to cover psychiatric disorders and sleep, and then we'll be done with the class after next week. So let's get started with the next slide. Listed on this slide is some of the objectives for this week under psychiatric disorders and sleep. First one is list the common mood disorders and anxiety disorders. Explain the techniques of identification and management of mood disorders, and explain the effect of mood disorders on sleep. This slide covers the next four objectives for this Unit 13 of psychiatric disorders and sleep. And they are: explain the method of identification and management of anxiety disorders, explain the effect of anxiety disorders on sleep, explain the interrelation of sleep-wake alterations and specific substances, and explain the role of drug dependence on sleep. Okay, we're going to go over the first objective for Unit 13 under psychiatric disorders and sleep, which is list the common mood disorders and anxiety disorders. A little bit about a definition of mood disorders, which are generally in an emotional state. If they become distorted or inconsistent, it can interfere with your ability to function, including sleep. When mood is not consistent with life events, they are said to have a mood disorder. It's normal to have changes in mood or affect. The idea is not to have it last over a long period of time. Mood disorders include major depressive disorder, bipolar disorder, and season affective disorders. Mood disorders may increase the risk of suicide. Anxiety disorders can also affect your mood and often occur with depression. For most people, though, mood disorders and anxiety disorders can be successfully treated with meditation and talk therapy. First, we're going to cover the mood disorders that are listed below with a small definition. We'll get into depth a little bit further later on those. So some of the mood disorders I found include the major depressive disorder. This is prolonged and persistent periods of extreme sadness. There's a bipolar disorder, also called manic depression or bipolar affective disorder. This is depression that includes alternating times of depressions and of mania. Seasonal affective disorder, or SAD, is a form of depression most often associated with fewer hours of daylight in the far northern and southern latitudes, from late fall to early spring. Cyclothymic disorder is a disorder that causes emotional ups and downs that are less extreme than bipolar disorders. We also have premenstrual dysphoric disorder. Mood changes and irritability occurs during the premenstrual phase of women. This slide depicts more mood disorders. Persistent depressive disorder, dysrhythmia, or a long-term chronic form of depression. Disruptive mood dysregulation disorder is a disorder of chronic, severe, and persistent irritability in children. Includes frequent temper outbursts that are inconsistent with the child's developmental age. Depression related to medical illness. This is a persistent depressed mood and is significant loss of pleasure in most or all activities that are directly related to physical or another medication condition. And then we have depression induced by substance use or medication. This is a depression that has symptoms that develop during or soon after substance use or withdrawal and after exposure to medication. Okay, next we're going to cover anxiety disorders. The first one is separation anxiety disorder, which is characterized by a persistent fear of being away from home or without attachment figure. This causes significant distress and may also be prone to nightmares and have excessive anxiety about unwelcome events happening to their attachment figure. Selective mutism generally is seen in children. It's their inability to speak in social situations. It can last into adulthood if a child does not receive treatment. Different than a communication disorder, it must be present for at least 1 month. Specific phobia. Specific phobia is when a person experiences extreme anxiety when they anticipate exposure or are exposed to a feared stimulus. Examples of these could be blood injections that include needles or a medical procedure, situational type like flying in an airplane or enclosed spaces, and other type which is a phobia that does not fit into the previous categories. Social anxiety disorder is characterized by extreme fear of social situations, extreme fear of criticism or scrutiny by others in the social situations. Intense fear often leads to avoidance of the social situation and can cause impairments in school and in relationships. Okay, we're going to move to the next objective on your syllabus, which is explain the technique of identification and management of mood disorders. There is an intimate relationship between emotional functioning and sleep. Psychiatric disorders are common in our society. Understanding the symptoms associated with these conditions is crucial to evaluation. Psychiatric disorders are often treated with medications, and sleep architecture during a sleep study may reflect the effects of the medication used to treat psychiatric disorders. We know sleep affects mental state, so sleep is closely connected to mental and emotional health and has links to depression, anxiety, bipolar disorder, and other conditions. It is a bi-directional relationship. Mental health disorders tend to make it harder to sleep well, and sleep tend to affect the mood in both depression, anxiety, bipolar disorder, and other conditions. By improving sleep, it can have a beneficial impact on mental health. Each stage of sleep plays a role in the brain health, allowing activity in different parts of the brain to ramp up or down and enabling better thinking, learning, and memory skills. Sufficient sleep, especially in REM, facilitates the brain's processing of emotional information. Lack of sleep is harmful to the consolidation of positive emotional content. If there's concern that you have a mood disorder, first you need to understand the symptoms associated with conditions that are critical to evaluating the patient properly. Creating the optimal sleep environment that addresses the challenges that can arise during the PSG procedure. Make an appointment to see the doctor or mental health professional as soon as possible. If reluctant to seek treatment, talk to a friend or a loved one or someone you trust. Talk to a healthcare professional when you feel like your emotions are interfering with your work, relationships, and social activities, or other parts of your life. You have trouble with drinking or drugs, or you have suicidal thoughts or behaviors that seek emergency treatment. It's unlikely to go away on its own. It may get worse over time, but it may be easily to treat early on. If problems continue to persist, you may want to see a medical provider and ask about an evaluation for sleep problems and mental health concerns. Want to stay alert for depression, hopelessness, helplessness, or sad, trouble concentrating, remembering things, loss of energy, daytime sleepiness, loss of interest in activities, thoughts of suicide or death. Then after the evaluation diagnosis, your provider can advise you on the best course of treatment. Options may include behavioral or other forms of therapy and/or medications. Taking steps to ensure adequate sleep will lead to improved mood and well-being. The way that sleep and mental health are intertwined becomes apparent by reviewing what is known about how sleep is tied to several mental health conditions. Depression is a type of mood disorder and marked by feelings of sadness and hopelessness. About 75% of depressed individuals show symptoms of insomnia. Many others also suffer from excessive daytime sleepiness and hypersomnia. In treating depression, for at least some people, a focus on improving sleep may correlatively benefit the reducing of symptoms of depressions. Seasonal affective disorder is a subtype type of depression that most often affects people during times of the year when there's reduced daylight hours. This condition is closely tied to the disruption of a person's internal biological clock or circadian rhythm that helps control multiple body processes, including sleep. They tend to sleep too much or too little or experience changes other in sleep cycles. First and utmost, you want to take sleep problems seriously. You should tell your doctor if you have trouble falling or staying asleep, feel tired during the day, have physical pain, discomfort, or other complaints that prevent you from getting a good night's sleep. Treatments such as cognitive behavioral therapy for insomnia and continued positive airway pressure for apnea may be helpful. If you have insomnia or depression, don't assume that medical treatment for one will automatically cure the other. Some treatments such as serotonin reuptake inhibitors and other medications may improve your mood and outlook, but not be enough to improve your sleep. Lingering sleep problems in people undergoing depression treatment increase the risk of sliding back into depression. Also, some early evidence that cognitive behavioral therapy, along with depression treatment, improves sleep in people with depression and may increase the chances of remission of the depression. We're going to move on to the next objective, which is to explain the effect of mood disorders on sleep. Sleep and mood are closely connected. Sleep disturbances are among the most common symptoms in patients who have acute episodes of mood disorders. And patients who have mood disorder exhibit higher rates of sleep disturbances. Insomnia and hypersomnia are associated with an increased risk of mood disorders. Sleep and mood are closely connected. Poor or inadequate sleep can cause irritability and stress, while sleep can enhance well-being. Chronic insomnia may increase the risk of developing a mood disorder such as anxiety or depression, and poor sleep and feelings of depression or anxiety can be helped through a variety of treatments, starting with improved sleep habits and, if needed, extending to behavioral interventions and assessment. Okay, we're moving on to the next objective listed on your agenda or syllabus, which is explain the method of identification and management of anxiety disorder. First, we're going to go through some different anxiety disorders. So the first one I have is generalized anxiety disorder, or GAD. This is a challenge to diagnose because people consider attacks a hallmark of an anxiety disorder, but GAD is different in that there are generally no panic attacks associated with the condition. As a result of this misconception, without the experience of panic attacks, a person may think they are just worrying too much. Their struggles with constant worry may be minimized or dismissed and, in turn, not properly diagnosed or treated. Most of us experience worry in situations that can cause us to feel anxious. Professionals looking to help determine if someone's worry and anxiety are related to GAD are looking for factors like hindering worry paired with a variety of physical symptoms, and use diagnostic assessments to make a diagnosis and rule out the other possibilities. Another anxiety disorder is agoraphobia. This is the fear of situations or places that may cause feelings of panic, entrapment, helplessness, or embarrassment. Fear of leaving the house, of crowds, traveling, elevators, movie theaters, malls, and etc. may be a recurrent panic attack. Agoraphobia can make you feel afraid and isolated. Your healthcare provider also may suggest medications called selective serotonin reuptake inhibitors, or SSRIs, or serotonin norepinephrine reuptake inhibitors, or SNRIs. These medications can treat depression and anxiety disorders. Using cognitive behavioral therapy, a mental health care provider can help you recognize thoughts that cause you anxiety. Then you'll learn ways to react to them more productively. The following lifestyle changes may also help you manage agoraphobia. Avoid alcohol, caffeine, and other substances. eat a healthy, well-balanced diet, exercise regularly, and practice breathing exercises. No medication that is specifically approved for agoraphobia, but the doctor may prescribe medications to prevent and reduce panic symptoms. The next one we're going to talk about is substance medication-induced disorder. This is an anxiety disorder in which anxiety or panic occurs after using alcohol, drugs, or medications. You cannot have experienced anxiety before you started taking the substance, even if the substance made anxiety symptoms worse. The official name for insomnia or other sleep problems which are caused by use of alcohol, drugs, or taking certain medications. Different from temporary insomnia or exhaustion. Induced sleep disorder interferes with sleep more significantly, and negative effects last much longer. There are four main types of substance-induced sleep disorder. Nighttime sleepiness type, where the person is not feeling rested from sleep. Daytime sleepiness type, where the person feels excessively sleepy or tired during the daytime, or less often sleeps for a very long time, perhaps longer than wanted. Parasomnia type, a person who can experience abnormal behaviors during sleep. And mixed time, which is a person has several different sleep symptoms with no particular symptom dominating. On this slide, we have a list of drugs that can cause substance medication-induced sleep disorder. Psychoactive substances include alcohol, caffeine, cannabis, opioids, sedatives, hypnotics, antioxylytics, amphetamines, cocaine, and tobacco. Drugs that are known to cause substance medication-induced sleep disorder include adrenergic agonist or anti-agonist, dopamine agonist or anti-agonist, antihistamines, and corticosteroids. Treatment of substance medication-induced disorder. First, it must be determined if the person had sleep problems prior to the using of alcohol, drugs, or medications before the diagnosis can be determined. Many different causes of sleep disorders can be improved by lifestyle changes in addition to reducing or eliminating alcohol, drugs, or medications with the side effects that interfere with normal sleep. The next anxiety disorder I want to talk about is anxiety disorder due to another medical condition. This is described as due to medical condition that occurs when a medical condition causes extreme fear, anxiety, or panic. Anxiety or worry about a medical condition is not considered an anxiety disorder. Diagnosis is only if anxiety and panic symptoms are present. Other specified anxiety disorder is described as it may be diagnosed if you have most but not all the criteria for an anxiety disorder, when few of the symptoms are there to meet the full standards are not met. Anxiety often causes significant distress, but standards are not met. Another anxiety disorder is called unspecified anxiety disorder. This is diagnosed if you experience anxiety or panic, but don't meet the full criteria for the symptoms of another. The next anxiety disorder we're going to talk about is a panic disorder. It is a common mental health condition in which a person experiences recurrent panic attacks. There's an extreme surge of fear and discomfort due to a perceived loss of control and can trigger a panic attack. Physical symptoms can include any or a combination of all the symptoms below: dizziness, nausea, racing heart, shaking, trembling, unsteadiness, shortness of breath, sensation of choking, chest pain, abdominal pain, fear of losing control, and fear of dying. The next anxiety disorder I'm going to talk about is separation anxiety disorder. It is characterized by a persistent fear of being away from home or without an attachment figure. This causes significant distress, may also be prone to nightmares, and have excessive anxiety about unwelcome events happening to their attachment figure. So next one we're going to talk about is social anxiety disorder. This is characterized by extreme fear of social situations, extreme fear of criticism or scrutiny by others in social situations. Its intense fear often leads to avoidance of social situations and can compromise impairments in school, work, and relationships. Treatment depends upon how much social anxiety disorder affects your ability to function in daily life. Most common treatment includes psychotherapy. Cognitive behavioral therapy is the most effective. Medications are also available, SSRIs or SNRIs, antidepressants or anti-anxiety medications, or beta blockers. Next, we have selective mutism. Generally seen in children, it's an inability to speak in specific social situations. It can last into adulthood if the child does not receive treatment. Different than communication disorder, it must be present for at least 1 month. Treatment the most common is behavioral therapy using controlled exposure, where the therapist works with the child and parent over time to approach a setting in which the child cannot speak. Next on the list is specific phobia. This specific phobia is when a person experiences extreme anxiety when they anticipate exposure or are exposed to a feared stimulus, such as blood injections, including needles or medical procedures. A situation type, like flying on an airplane in an enclosed space. Other types would be phobias that do not fit in the previous categories. The best treatment for the form of psychotherapy known as exposure therapy. Understanding the cause is less important than how to treat the avoidance over time. With anxiety disorders, the goal is to sleep more soundly. Making a good night's sleep a priority. You need to block out 7 to 9 hours for a full night of uninterrupted sleep. Establish a regular relaxing bedtime routine. Make sure the bedroom is cool, dark, and quiet. Consider a fan to drown out excessive noise. Use a bedroom as a bedroom, not for TV or doing work. If you have not fallen asleep in 15 minutes, go to another room. Regular exercise will help you sleep better. Avoid looking at the clock. It can make you anxious, and talk to your doctor if you're still having problems falling asleep. Treatment options for anxiety disorder also include cognitive behavior therapy, as well as relaxation techniques and medication. Your doctor or therapist may recommend one or a combination of treatments. To reduce anxiety and stress, meditate. Focus on your breath, breathe in and out slowly and deeply, and visualize serene environments such as a deserted beach or grassy hill. Exercise. Regular exercise is good for your physical and mental health. Prioritize your to-do list. Spend your time and energy on tasks that are truly important, and break up large projects into smaller, more easily managed tasks. Play music. Soft, calming music can lower your blood pressure and relax your mind and body. Get adequate amount of sleep. Sleeping recharges your brain, improves your focus, concentration, and mood. Direct stress and anxiety elsewhere. Lend a hand to a relative or neighbor, or volunteer in your community. Helping others will take your mind off your own anxiety and fears. And last, talk to someone. Let friends and family know how they can help, and consider seeing a doctor or therapist. Okay, we're nearing the end of the lecture with the next objective: explain the interrelation of sleep-wake alterations and specific substances. So the regulated alternations between wakefulness and sleep states reflect a complex behavioral processes. It's orchestrated by distinct neurochemical changes in the brain, paramecia. No single neurotransmitter or neuromodulator controls the sleep-wake states in isolations. Rather, fine-tuned interactions within organized neural circuits regulate waking and sleep states and drive their transitions. Sleep and substance abuse interconnects, such as the alterations in one process has consequences for the other. There are several types of medications available for social anxiety. Selective serotonin reuptake inhibitors, or SSRIs, are often the first type of drug tried for persistent symptoms of social anxiety. Serotonin and norepinephrine reuptake inhibitor, or SNRI, is another drug used. Other medications include antidepressants, typically trying several different antidepressants to find the one that's most effective. Anti-anxiety medications such as benzodiazepines may reduce anxiety, work quickly, but are habit-forming and sedating, so it's prescribed for short-term use only. Beta blockers work by blocking stimulation effort of epinephrine. It may reduce heart rate, blood pressure, have a pounding heart, shaking voice and limbs. It's not necessarily recommended for general treatment. Okay, we're on the last objective, which is explain the role of drug dependence on sleep. Acute exposure to drugs of abuse disrupts sleep by affecting sleep latency, duration, and quality. With chronic administration, sleep disruption becomes more severe, and during abstinence, insomnia can occur with a negative effect. Sleep impairments associated with drug abuse also contribute to cognitive dysfunction in addicted individuals. Because sleep is important in memory consolidation and the process of extinction, sleep dysfunction might interfere with the learning of non-reinforced drug association needed for recovery. Exposure to drugs of abuse is causal to sleep dysfunction that further promote chronic use. Sleep disorders in turn are risk factors for substance abuse and their severity. Sleep disruptions result in accumulation of risk factors that drive drug abuse, including increasing sensitivity to pain, acting as a stressor, and biasing toward a negative effect. Recognizing and treating sleep disorders may be important preventive measure against future drug misuse. Interaction between sleep and substance use is shaped by genetics, life events, sex, and circadian rhythms remains unknown. Chronic use tolerance occurs to sleep-enhancing effects of cannabis, and abstinence is characterized by unusual dreams and poor sleep quality that is predictive of relapse. It is becoming well accepted that there are neurobiological links between sleep dysfunction and substance abuse behavior that result in comorbidity. Research is still in its infancy. More research to fill the knowledge gaps at the intersection of sleep, drug reward, and addiction will help identify treatment targets that improve quality of life of individuals suffering from sleep and substance use disorders. Okay, that concludes this week's objectives under Unit 13, Psychiatric Disorders and Sleep. As usual, if you have any questions, please feel free to email me, and hopefully this is a good introduction to this particular unit. I'll see you next week. Have a great week.